colleagues and friends, as you know, over the next weeks, we are going to have to find ways to support the communities in our country that are most vulnerable during this pandemic. I want to suggest the following community-based social support model. What this is about is using the school networks, local schools in communities, working alongside NGO networks and churches, mosques, or temples in collaboration with the health services and the police to take social support to the communities that are most vulnerable. How this would work is we take a local school and we rally the NGOs and faith communities around that school, and we use that school as a depot for sanitizer stocks as well as food stocks for communities that are most vulnerable. What this allows us to do is to create mechanisms whereby the community coming to collect these stocks will be safe. We can put in place health checks, temperature checks, social distancing mechanisms. We can work with the police to ensure that these facilities are secure, dealing with the security concerns around the distribution of these stocks in a controlled way. That will allow for safe distribution. It will also allow for the safety of health workers, early detection. If we're in communities doing temperature checks, volunteers would be able to work alongside this infrastructure to volunteer their time in a safe way. And we will be able to mobilize the informal distribution networks either through the school or the NGOs or churches that are closest to communities that know which families are most vulnerable and can serve as an early warning and detection mechanism for bigger societal issues that might emerge. Lastly, what this will allow us to do is to attack the pandemic in a decentralized way, leveraging our capacity in various communities to do our best to serve the needs of the community as they face this challenge.